Well, as we wrap up Breast Cancer Awareness Month, today we want to highlight a type of breast cancer that does not show up on mammograms.
It'll instead leave you with a rash. 9 News medical expert Dr. Payal Kohli joins us to talk about inflammatory breast cancer. And this is a cancer that doesn't show up on a mammogram. So, I mean, how do you diagnose it?
Yes, which is one of the reasons we should talk about it, because many of us miss it. So inflammatory breast cancer, very rare, only 2 to 4% of breast cancer, but so deadly because it's usually spread by the time it shows up. So it's a cancer that actually gets clogged up into the lymphatic drainage of the breast. So that's kind of the drainage of the breast that takes the water out of the breast. You think about clogging up the water supply of the breast, you get swelling in the breast, you can get a rash on the breast. The breast surface can change and appear like an orange peel, so it's called peau d'orange. It actually gets kind of that orange peel sort of look to it. A lot of women will just have breast fullness, they might have itchiness, they might have pain, it might even look like a bug bite. So it's really something you have to keep your radar up on, because it's not showing up at that mammogram. You really need to get an MRI or a biopsy in order to diagnose it.
So you just listed some of the descriptions of it, right, to look out for. If you're not, are you developing a lump at all? So what are the exact symptoms besides the itchiness and like the orange peel look?
So some people will just have a little bit of a rash. So you might notice a rash or dimpling of the nipple or some sort of change on the surface of the breast. So any redness, swelling, or pain in the breast should trigger you to think about potentially this type of cancer. Some people will feel like their breast is full, like they're nursing. And they're not nursing, but they feel like the breast is full because, again, the water drainage of the breast has been affected by this cancer, so you can feel that fullness in your breast. Most of the time when it's diagnosed with those type of symptoms, it's already spread. So by definition, at diagnosis, it's stage 3 or higher, which is why it's really important to move quickly with this one.
Yeah, and that's what I was going to ask you, just how quickly does it spread? But it seems like pretty quickly.
Well, it's already spread by the time you've diagnosed it, but it can spread further within days or weeks. So we normally think about cancer, it takes a little time to grow. You know, you get a diagnosis, then you get a biopsy, then you get medication therapy started. Not in this case. In this case, the house is on fire. You got to move really, really quickly. So the reason I bring that up is because if a woman feels any kind of a change in her breast size and her breast fullness, breast pain, you do not wait to make that call to your doctor. You call right away. Because if it is, God forbid, this type of inflammatory breast cancer, which unfortunately happens more in younger women, happens more in African Americans, people who have extra weight on them, these are all higher risk groups for inflammatory breast cancer. We don't understand why, but you need to make that call, because within weeks, days to weeks, it can actually be spreading even very quickly.
I'm so glad you're bringing this up, because this is something I am unaware of.
Yes.
And, you know, I understand that you said you got to immediately call the doctor. So what would treatment look like? Is this curable?
So probably not curable in the sense, because it's already spread at the time of diagnosis, but the treatment has to be the most aggressive treatment, the biggest guns that you've got, right? Because it's such an aggressive cancer. So usually it looks like surgery where you have a mastectomy, get, you know, of course the breast removed, but also the lymph nodes to try to figure out how much it's spread. Chemotherapy is a part of this as well, to mop up any microscopic cells, because that drainage system of the breast, the water drainage system, is all over the body as well. So if it's in that drainage system, it can spread to other parts of the body as well. Usually women will also get radiation, so you're talking the triple whammy: surgery, chemo, radiation, and then whether or not they have a reconstruction is obviously a very private, you know, personal decision. And then they might even get targeted chemotherapy depending on the hormone receptor status of the cancer, whether it has HER2 on it. So you're really talking about the biggest guns in terms of treatment that we have, because it's such an aggressive cancer.
But women can survive this.
Yes, and so that's kind of the message here, is that the earlier that we get it out and get it treated, the better the survival. So the typical 5-year survival is about 70%. Which means, unfortunately, sadly, we lose 30% of our women at 5 years. But because of this kind of really rare type of cancer that hopefully none of us will ever have to think about, if you see a rash on your breast, any changes in the skin,
call your doctor.
Yes, don't just think it's an infection or a bug bite or, oh, I must have nicked it or something. You need to call your doctor.